Welcome to PEBA's Insurance Benefits Training. Let's take a look at the tools and resources PEBA offers. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. PEBA provides a variety of resources, including Employee Benefits Services, or EBS, the Benefits Administrator Manual, PEBA Update, our weekly e-newsletter for employers, the Plan of Benefits, the Insurance Benefits Guide, the Insurance Summary, our Navigating Your Benefits series, and the PEBA Health Hub. PEBA provides a variety of online resources to help employers. You can also participate in online question and answer sessions and employer advisory group meetings. Email employer services to request training assistance and share your feedback. The employer's webpage is a resource available to you too. Additionally, you can reach out to customer service by selecting the Contact Us button in EBS or completing the contact form on our website. Let's look at eligibility for PEBA benefits. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. Generally, all full-time equivalent employees are eligible for benefits coverage. Retirees, dependents, survivors, COBRA subscribers, and former spouses might also be eligible. Generally, insurance-eligible full-time employees are those who work at least 30 hours a week. Part-time teachers do not need to meet the 30-hour requirement to be eligible for limited benefits. Some employers have also chosen to give benefits to part-time employees who work at least 20 hours per week. Retired employees could be eligible to continue health, dental, and vision coverage if they retire from an employer that participates in the state insurance program and meets certain requirements. Coverage does not automatically continue at retirement. Temporary full-time and variable hour employees are not eligible for insurance benefits in retirement. Only PEBA can determine retiree insurance eligibility. The retiree packet includes eligibility flyers and the employment verification record form. If eligible, the retiree must enroll in coverage by submitting a retiree notice of election form within 31 days of their retirement date. Subscribers can often cover their current spouse. However, subscribers cannot cover spouses who work for an employer that participates in PEBA insurance benefits. They also cannot cover the spouse if the spouse is eligible for coverage as a funded retiree. Subscribers can cover their dependent children, when eligible. This includes their natural child, stepchild or adopted child, any child placed for adoption, foster child, and a child for whom they have legal custody. A child is eligible for coverage until age 26. To be eligible for dependent life child insurance, dependent children who are ages 19 through 24 must be a full-time student, unmarried, and cannot be employed on a full-time basis. Coverage for an incapacitated child may continue beyond age 26, when coverage would otherwise end, as long as the child remains eligible. The subscriber must submit proof of incapacity and dependency by completing the incapacitated child certification form and provide supporting documentation. Transactions involving incapacitated children must be completed with a notice of election. If the dependent child is employed with a participating employer, they can enroll as an active employee or as a dependent child. If the employee chooses to remain enrolled as a dependent child, they can do so only until age 26. It's important to note, however, that a dependent child is not eligible for certain covered services. When the dependent child loses coverage, the loss allows them to enroll in health, dental, and vision. If they would like to enroll in optional life or supplemental long-term disability, they must provide medical evidence. To enroll a spouse or child, the subscriber must submit all required documentation. This can be done online through My Benefits and EBS. The supporting documentation for insurance enrollments flyer, which is available online, provides a complete listing of acceptable documentation to prove the relationship of dependence. Keep in mind that the member might not have the appropriate documentation in hand before the enrollment deadline. If the deadline to enroll is close, submit the election of benefits without the documentation before the deadline, and then submit the documentation once it's available. The National Medical Support Notice is sent by state child support agencies to employers and plan administrators when an employee is obligated to provide employer-sponsored health coverage for a child by a court or administrative child support order. The notice serves as documentation needed for enrollment. By federal law, coverage-eligible employees cannot refuse to cover identified children. Coverage continues for the child until PEBA receives notice from the issuing agency to remove the child, or the employee loses insurance eligibility. When you receive an NMSN, immediately email it to PEBA's NMSN coordinator at medicalsupportnotices@peba.sc.gov. Employers need to complete Part A of the form, then return it to the issuing agency. Do not share information about the child or custodial parent with the employee. This includes names, addresses, social security numbers, and other contact information. If the employee requests information, you can share only the name and contact information of the issuing agency and case number. For additional help, check out the NMSN training resource at peba.sc.gov/insurance-training. Spouses and children who are enrolled in health, dental, and/or vision coverage at the time of the employee's death may be eligible to continue coverage as survivors. A surviving spouse can continue coverage until they remarry. A child can continue coverage until they turn age 26. As long as a survivor remains covered by health, dental, or vision coverage, they can add the other coverages during open enrollment or within 31 days of a special eligibility situation. If they drop all coverage through PEBA, they are no longer eligible as a survivor and cannot re-enroll in coverage, even during open enrollment. Survivors of active employees, and state-funded and partially funded retirees, are eligible for a 1-year waiver of health insurance premiums when a covered employee or retiree dies. After the waiver ends, survivors pay the employee and employer share of the premium to continue coverage. This is known as a non-funded survivor premium. There is one exception to this: survivors of an active employee who was killed in the line of duty will pay the funded survivor premium after the waiver ends. Survivors of non-funded retirees pay the full cost of premiums. Dental and vision premiums are not waived. Survivors pay the full cost for these benefits. Survivors of optional employer-employees should check with their benefits administrator for premium information. Monthly premiums are available at peba.sc.gov/monthly-premiums. COBRA requires continuation of health, dental, vision, and/or medical spending account coverage be offered if no longer eligible. Individuals must be covered at the time of a qualifying event to be eligible to continue these benefits through COBRA. Former spouses are not considered dependents. If a subscriber is court-ordered to cover a former spouse, then the former spouse can enroll and will be covered on their own individual policy. A former spouse may enroll in health, dental, and vision coverage. The coverage for a former spouse will be billed at the full amount of the premium separately from the subscriber's coverage. Premiums for a former spouse cannot be paid using pre-tax dollars. Subscribers must complete a former spouse notice of election form. Let's look at determining eligibility and the enrollment process. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the member-facing insurance benefits guide. As a participating employer in PEBA insurance benefits, you must offer coverage to all employees eligible to participate in the insurance benefits. Employers must understand the eligibility rules and definitions, monitor employee hours, offer coverage when eligible, and initiate the enrollment process. Resources are available at peba.sc.gov/ACA. The employer mandates of the Affordable Care Act define 3 categories of full-time equivalent employee. All employees will fall into one of these categories. A full-time employee is a permanent or non-permanent employee who has been determined by their employer as of their date of hire to be full-time and eligible for benefits. New full-time employees are expected to work 30 hours or more per week as of their date of hire. A variable hour, part-time, or seasonal employee is an employee who is not expected to average 30 hours per week during their first 12 months of employment as of their date of hire. Therefore, their hours must be monitored before becoming eligible for benefits. An ongoing employee is any employee who has worked with an employer for an entire standard measurement period. New full-time employees and retirees of a participating group can enroll within 31 days of the date of hire or date of retirement. New variable hour, part-time, and seasonal employees who average 30 hours during their initial measurement period may enroll during their initial administrative period. All eligible employees can enroll or make changes within 31 days of a special eligibility situation, such as birth, marriage, or gaining or losing other coverage for the employee or retiree and their covered dependents. If the employee or retiree does not enroll when they are first eligible or retires, they can enroll during the October enrollment period with a January 1 effective date. New full-time employees are expected to work 30 hours or more per week as of their date of hire. Full-time employees should be offered benefits at the time of hire and must enroll within 31 days of their date of hire. There is no waiting period or an initial measurement period for full-time employees. If an employee is hired on the first of the month, coverage will begin that day. If an employee is hired on the first working day of the month, but not on the first day of the month, for example, Tuesday, January 2, 2025, the employee can choose the first of that month or the first of the following month. For all other hire dates, benefits for new full-time employees become effective the first of the month after their date of hire. New variable hour, part-time, and seasonal employees are not eligible for insurance as of their date of hire. Instead, the employee must first average 30 hours during their first 12 months of employment to be eligible to enroll in insurance benefits. Employers do not expect or do not know if new variable hour, part-time, and seasonal employees will average 30 hours as of their date of hire. Employers must review the hours worked by variable hour, part-time, and seasonal employees during their first 12 months of employment to determine their eligibility for insurance. The initial measurement period begins the first of the month after the date of hire and ends 12 months later. The employer should review the employee's hours over the initial measurement period to determine future eligibility for insurance benefits. The initial administrative period begins the day after the initial measurement period ends and ends the last day of the same month. During the initial administrative period, the employer should review the hours worked during the initial measurement period, and if the employee averaged 30 hours, offer benefits to the employee effective the first of the following month. The initial stability period begins the day after the initial administrative period ends and lasts for 12 months. This is the period a new employee cannot lose eligibility for benefits, regardless of the number of hours they work. Here's an example of how the initial measurement, initial administrative, and initial stability periods apply to new variable hour, part-time, and seasonal employees. Brad's date of hire was June 6, 2025. His initial measurement period is July 1, 2025 to June 30, 2026. Benefits are not offered during this time, his employer is only monitoring his hours. Brad's initial administrative period is July 1 to July 31, 2026. During the initial administrative period, Brad's benefits administrator should determine if Brad averages more than 30 hours per week by adding all hours worked during the initial measurement period and dividing by 52 weeks. Hint: employees who work 1,560 hours or more will average 30 hours. Benefits administrators must offer coverage during the initial administrative period, and eligible employees must elect to enroll in or refuse benefits. Brad's initial stability period is August 1, 2026, to July 31, 2027. If Brad is determined to be eligible for coverage, he will remain eligible for benefits during this initial stability period, as long as he remains employed with the same employer. An ongoing employee is any employee, including full-time, variable hour, part-time and seasonal, who has been employed for a full standard measurement period. All employees will eventually become ongoing employees if they remain employed with the same employer and do not incur a break in employment of 13 or more weeks. The standard measurement period is October 4 to October 3 of the next plan year. This is the period an employer must monitor the hours worked by an employee to determine eligibility for the upcoming plan year. The administrative period is October 4 to December 31 each plan year. This is the period employers and the plan have to identify and enroll eligible individuals in coverage. Employers must offer, and newly eligible employees must enroll in, coverage during the plan's October enrollment period. PEBA uses the remainder of the administrative period to process enrollments to ensure employees have access to coverage at the beginning of the stability period. The stability period is the plan year, January 1 to December 31 each year. Ongoing employees, who average 30 hours or more during the standard measurement period, will remain eligible for benefits the entire stability period, regardless of the number of hours worked, as long as they remain employed with the same employer. During the October enrollment period, calculate the average hours of those employed the full standard measurement period by adding the total hours worked from October 4 to October 3, and divide by 52 to determine if an employee averaged 30 hours or more per week. If an employee remains eligible using the measurement period, no action is required. Employees can make changes to their coverage for the next plan year. If an employee loses eligibility, the employee's coverage continues until the end of their initial stability period if the employee is still within their initial stability period, or until the end of the stability period. If an employee is newly eligible for benefits, the employee may enroll during the October enrollment period. Benefits will become effective January 1 of the next plan year. Let's look back at our example. Remember, Brad was hired June 6, 2025. Since he is not a full-time employee, his benefits administrator would not offer benefits immediately. Instead, the benefits administrator would measure his hours during the initial measurement period of July 1, 2025 through June 30, 2026. His initial administrative period will be July 1 to July 31, 2026. This is the period when the benefits administrator will determine if he is eligible for benefits. If he is, he needs to enroll in or refuse coverage, and he will remain eligible for the entire initial stability period, which is August 1, 2026, to July 31, 2027, regardless of the number of hours he works during that time. During the 2026 administrative period, Brad has been employed a full standard measurement period, which is October 4, 2025 through October 3, 2026. He is now an ongoing employee. Brad's hours will be reviewed with all ongoing employees using the standard measurement period to determine if he is eligible for coverage for the remainder of plan year 2027, or rather, after July 31, 2027. At the end of the initial stability period, the employee has been employed a full standard measurement period. Look back and review the average number of hours worked during the previous standard measurement period. If the employee averaged 30 hours or more per week during the standard measurement period, benefits continue for the remainder of the standard stability period or plan year. If the employee averaged fewer than 30 hours per week, insurance coverage ends at the end of the initial stability period. Review hours again in October to determine eligibility for the next plan year. Here is an example of an employee eligible to continue coverage at the end of the initial stability period. Brad averaged 30 hours per week during the standard measurement period of October 4, 2025 through October 3, 2026. Brad's initial stability period ends on July 31, 2027. Because he has averaged 30 hours per week during the previous standard measurement period, his benefits will continue after July 31, 2027. Brad's benefits administrator will review his hours during the October administrative period to determine eligibility for the next standard stability period or plan year, which is January 1, 2028 through December 31, 2028. Here is an example of an employee not eligible to continue benefits at the end of her initial stability period. Kelly is a new part-time employee who is eligible for benefits during her initial stability period, which is July 1, 2025 through June 30, 2026. Kelly does not average 30 hours per week during the standard measurement period, which is October 4, 2025 through October 3, 2026. When the 2026 plan year begins in January, her coverage will continue, because she is still within her initial stability period. On June 30, 2026, Kelly's coverage will end, and COBRA continuation coverage should be offered. From now on, Kelly will be measured only during the standard measurement period. In October, during the 2026 standard administrative period, Kelly's benefits administrator will review the number of hours worked during the standard measurement period of October 4, 2025, through October 3, 2026, to determine eligibility for the 2027 plan year. Let's look at the annual open enrollment period. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. During open enrollment each October, subscribers can enroll in, drop, or change health plans. They can also enroll in or drop the state vision plan. Additionally, subscribers may add or drop dependents from health and vision coverage. They can enroll in or increase optional life and/or dependent life spouse insurance, and medical evidence might be required. Subscribers can also enroll in dependent life child insurance. Be mindful that subscribers may enroll in dependent life child coverage during the year. They can also decrease or cancel optional life and/or dependent life spouse insurance. Additionally, subscribers can apply for supplemental long-term disability with medical evidence, if applicable. They can also enroll or re-enroll in Money Plus flexible spending accounts. Finally, they can enroll in or change contributions to their health savings account. During open enrollment in odd-numbered years, subscribers can enroll in or drop Dental Plus or Basic Dental. Subscribers can add or drop dependents from dental coverage, too. Subscribers can also make other changes as announced during annual open enrollment. You are responsible for distributing hard copies of federally mandated notices to insurance-eligible employees by October 1 each year. You must also review any other insurance products you might offer. You'll need to monitor the hours of all employees, identify employees, and offer benefits, as a newly eligible employee, for the next plan year. If an employee is determined to be ineligible, notify them of their loss of eligibility for the next plan year. During open enrollment, review and update salary information for supplemental long-term disability subscribers. And, when applicable, prepare and issue COBRA initial notices. PEBA publishes a web page for members before open enrollment begins. A web page with helpful resources for employers during open enrollment will also be available before the start of the open enrollment period. This includes employer responsibilities, the marketing toolkit, and links to publications and forms. Watch PEBA update for open enrollment session dates. Let's look at insurance benefits PEBA offers. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. All participating employers must offer their insurance-eligible subscribers all the insurance programs PEBA offers. Employers cannot offer products and programs that are available through or in direct competition with what PEBA offers. Employers may offer products not offered by PEBA, however, premiums for those products cannot be paid pre-tax through MoneyPlus, PEBA's flexible benefits plan. Health and dental programs offered through PEBA might be eligible for coordination of benefits. When one spouse works for a participating employer and the other spouse works for an employer that does not participate with PEBA, the employee and spouse may be eligible to enroll in two health or dental plans. The plan that covers a person as an employee is primary to the plan that covers the person as a dependent. When both parents cover a child, the plan of the parent whose birthday comes earlier in the year is primary. An employee and their spouse, who is also covered as an employee or retiree with PEBA, may share the same deductible and co-insurance if they are enrolled in the same health plan. The benefit options offered by PEBA include health plans, dental coverage, vision care, life and long-term disability insurance, as well as MoneyPlus and health savings accounts. Insurance orientation and education available at peba.sc.gov/new-employees explains the benefit options, enrollment and resources for eligible employees. Eligible employees have 31 days to enroll. Employers should initiate the enrollment in EBS so the employee can make elections in My Benefits. Plan roles are already integrated into system, so encourage employees to make their elections online. For details about the benefits, direct eligible employees to peba.sc.gov/new-employees. You should also provide the insurance enrollment guide for new hires and new hire notices. These are the 2026 monthly employer contributions for active employees. Optional employer contributions can vary. Optional employers are subject to experience rating, or load factor, of health insurance premiums. So employer contributions and subscriber premiums might be different than those published in PEBA publications. The load factor is added to health premiums based on claims history and adjusted each year. Employers receive written notification of the load factor each March, and the amount is applied in January of the following year. Let's look at PEBA's health plans. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. There are two plans available under the State Health Plan, the Standard Plan and the Savings Plan. PEBA also offers the TRICARE Supplement Plan. The State Health Plan is a self-funded plan. Members' premiums and your employer contributions are not paid to an insurance company. Instead, they are placed in a trust fund. PEBA pays claims and the plan's administrative expenses from this trust fund. Blue Cross Blue Shield of South Carolina is a third-party administrator that processes medical claims for the state health plan. Caremark processes prescription claims. To understand the expense of the state health plan compared to other public and private sector plans, we encourage you to review the state health plan's benchmarks. Many of the features of the state health plan's standard plan and savings plan are the same. Both have worldwide coverage, as well as network and out-of-network benefits. They also both offer prescription coverage and prior authorization for certain services. Subscribers have online access to their benefits and claims history through the Blue Cross Blue Shield of South Carolina website. When subscribers use a network provider, they pay co-payments, deductibles, and co-insurance. The provider files the claim and will accept the allowed amount, which is the most the plan allows paying a provider for a covered service. When the provider is in network, this allowed amount serves as payment in full. To locate a network provider, go to www.statesc.southcarolinablues.com. Caremark is the state health plan's pharmacy benefits manager. Members must use a network pharmacy to receive benefits. Certain medications might require prior authorization. Prescription birth control is covered at no cost for primary subscribers, covered spouses, and covered child dependents. To compare medication costs, go to caremark.com. The standard plan has a $515 annual deductible for individuals and a $1,030 family deductible. Once a standard plan subscriber meets the deductible at network providers, the plan pays 80%. The subscriber pays the remaining 20%. There is a $3,000 individual coinsurance maximum. The family maximum is $6,000. There are also copayments for services, including a $15 office visit copayment. The copayment for outpatient facility services is $115, and the copayment for emergency room visits is $193. If a subscriber is admitted to the hospital, the copayment is waived. Standard plan subscribers also pay copayments for prescriptions from a network pharmacy. There is a $3,000 annual coinsurance maximum per person for prescription drugs. The savings plan is a high-deductible plan. The deductible is $4,000 for individuals and $8,000 for a family. Once a subscriber meets the deductible at network providers, the plan pays 80%. The subscriber pays the remaining 20%. The network coinsurance maximum is $3,000 for individuals. The family maximum is $6,000. Savings plan subscribers pay the full allowed amount for prescriptions until they meet their annual deductible. Then, the plan will pay 80%. The subscriber is responsible for the remaining 20%. Additionally, because the savings plan is a high-deductible plan, subscribers are eligible to enroll in a health savings account and limited-use medical spending account. Some services, such as inpatient care, require prior authorization. This means the state health plan must confirm it will pay before you receive the service. Medi-Call, the plan's managed care program, promotes high-quality, economical care through reviews that assess, plan, implement, coordinate, monitor, and evaluate health care options and services required to meet an individual's needs. While the health care provider may make the call for the member, it is the member's responsibility to see that the call is made. For emergency hospital admissions, Medi-Call must be contacted within 48 hours or the next working day after a weekend or holiday. Advanced radiology services, such as CT, MRI, MRA, and PET scans, must have prior authorization from Evolent. If a network South Carolina physician or radiology center does not request prior authorization for advanced radiology services, the provider will not be paid for the service, and it cannot bill the subscriber for the service. Companion Benefit Alternatives provides prior authorization for mental health and substance abuse facility services, as well as some professional services. Claims for mental health and substance abuse are subject to the same deductibles, copayments, and coinsurance as medical claims. The state health plan covers one adult well visit every year at no member cost. Eligible female members can also receive an annual well woman visit at no member cost in addition to the annual adult well visit. Evidence-supported services advised by A or B recommendations by the United States Preventive Services Task Force are included. The TRICARE Supplement Plan is administered by Selman & Company and is sponsored by the Government Employees Association. The plan provides secondary coverage to TRICARE, which is the Department of Defense's health benefit program for the military community. For those who are eligible, it is an alternative to the state health plan. PEBA does not confirm eligibility for the TRICARE Supplement Plan. Eligible individuals must register with the Defense Enrollment Eligibility Reporting System, or DEERS, must not be eligible for Medicare, and must drop state health plan coverage to enroll. Those enrolled in the TRICARE Supplement Plan are not eligible for COBRA. Because of federal regulations, the employee pays the full premium for the TRICARE Supplement Plan. Those enrolled in the TRICARE Supplement Plan are not subject to the tobacco use premium. Here are the active employee premiums for the health plans offered in 2026. Premiums for optional employers can vary. We encourage you to use the monthly premium worksheet for optional employers if your group's premiums are different. The tobacco use premium applies to state health plan subscribers only. The premium is $40 per month for those subscribers who cover no dependents. The premium is $60 per month for other levels of coverage. Subscribers can avoid this charge by certifying that neither they nor any covered dependents use tobacco or e-cigarettes, or that all covered tobacco or e-cigarette users have completed the plan's tobacco cessation program. Subscribers can pay the tobacco use premium pre-tax if they are enrolled in the pre-tax group insurance premium feature. Let's look at dental plans, which are administered by Blue Cross Blue Shield of South Carolina. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. There are two options for dental coverage. The first option is Dental Plus. It pays more, and has higher premiums and lower out-of-pocket costs. Dental Plus also has higher allowed amounts, which are the maximum amounts allowed by the plan for a covered service. Network providers cannot charge subscribers for the difference in their cost and the allowed amount. Subscribers can also elect Basic Dental, which pays less, and has lower premiums and higher out-of-pocket costs. Basic Dental has lower allowed amounts, which are the maximum amounts allowed by the plan for a covered service. There is no network for Basic Dental. Therefore, providers can charge subscribers for the difference in their cost and the allowed amount. Subscribers may enroll in dental coverage at their initial eligibility. They may also enroll in, drop, or change coverage during open enrollment in odd-numbered years, or if they experience a special eligibility situation. Subscribers do not pay a deductible for exams, cleanings, or X-rays, and the plan will pay 100% of the allowed amount. For fillings, oral surgery, or root canals, subscribers pay up to a $25 deductible per person, and the plan will pay 80% of the allowed amount. Remember, Dental Plus has a higher allowed amount. Subscribers pay up to a $25 deductible per person for crowns, bridges, dentures, or implants, and the plan will pay 50% of the allowed amount. For orthodontics, subscribers do not pay a deductible, and there is a $1,000 lifetime benefit for each covered child, regardless of plan or plan year. With Dental Plus, the maximum payment is $2,000 per person each year for diagnostic and preventive, basic, and prosthodontic services. The maximum payment for basic dental is $1,000 per person each year for diagnostic and preventive, basic, and prosthodontic services. The monthly premium is determined by the plan and coverage level. Premiums for optional employers can vary. We encourage you to use the monthly premium worksheet for optional employers if your group's premiums are different. Let's look at vision coverage, which is administered by IMED. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. The state vision plan coverage includes comprehensive eye exams, frames, lenses and lens options, and contact lens services and materials. Subscribers can also receive discounts on extra pairs of eyeglasses, contact lenses, and LASIK and PRK vision correction. Additionally, the plan offers coverage for diabetics, including office service visits and retinal imaging. If needed, subscribers may choose to get frames and lenses or contact lenses each year, but not both, in the same plan year. There are no claims to file when the subscriber uses a network provider. The subscriber is responsible for co-payments and any charges that remain after allowances and discounts have been applied to their bill. If the subscriber uses an out-of-network provider, they must pay the provider for services in full and file a claim for reimbursement. IMED will reimburse the subscriber for a portion of the expenses for certain services. For reimbursement amounts for services received from an out-of-network provider, refer to the plan's schedule of benefits. A list of participating providers can be found at imedvisioncare.com/PEBA-OE. Be sure to check out the vision coverage at a glance flyer too. Subscribers pay a $10 copayment for an eye exam at a network provider and up to $39 for retinal imaging. Subscribers have a $150 allowance for frames at a network provider. Then, they will pay 80% of the remaining balance. They can obtain standard plastic lenses for a $10 copayment or standard progressive lenses for a $35 copayment. For premium progressive lenses, subscribers will pay $35 to $80, depending on the tier. For Tier 4, they'll pay a copayment plus 80% of the remaining cost less a $120 allowance. There are no copayments for contact lenses. A standard contact lens fit and follow-up visit at a network provider has no cost. For a premium contact lens fit and follow-up, subscribers will receive 10% off the retail price less a $40 allowance. There is a $130 allowance for conventional contact lenses, and subscribers will pay 85% of the remaining cost. There is also a $130 allowance for disposable contact lenses, but subscribers will pay the full balance over this amount. Here are the monthly premiums for the State Vision Plan. Premiums can vary for optional employers. We encourage you to use the monthly premium worksheet for optional employers if your group's premiums are different. Let's look at life insurance benefits, which are insured by MetLife. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. Basic life insurance offers $3,000 in term life insurance coverage with a matching amount of accidental death and dismemberment insurance. Subscribers are automatically enrolled in basic life insurance at no cost if they enroll in health insurance. The employer cost is 38 cents per month per subscriber. Subscribers can choose optional life insurance for themselves in increments of $10,000 up to a maximum of $500,000. When they first become eligible, they are guaranteed 3 times their annual salary or $500,000, whichever is less, within the first 31 days. This means they don't have to provide medical evidence. Medical evidence is required for additional coverage and if subscribers decide to add coverage after their initial eligibility. With optional life, subscribers also get a matching amount of accidental death and dismemberment insurance. It's important to note that coverage will automatically reduce once a subscriber reaches certain ages, beginning at age 70. Dependent life spouse insurance is available in increments of $10,000 up to a maximum of $100,000 or 50% of a subscriber's optional life coverage amount, whichever is less. Subscribers can get spouse coverage even if they aren't enrolled in optional life, too. In this case, it's available in the amounts of $10,000 or $20,000. Medical evidence is required for additional coverage and if they decide to add coverage after their initial eligibility. At initial eligibility, subscribers are guaranteed dependent life spouse coverage up to $20,000. This means they do not have to provide medical evidence for this coverage when they enroll. Dependent life spouse also includes a matching amount of accidental death and dismemberment insurance. Dependent life child insurance of $15,000 per child is available. Subscribers can add eligible children without medical evidence. Children are eligible from live birth to age 19 or 25 if the child is a full-time student, unmarried, and not working full-time. If both parents are eligible to provide coverage through PEBA, each child can be covered by only one parent under this plan. Eligible dependent children may be enrolled at initial eligibility or throughout the year. For the online statement of health, select the Life Insurance SOH button on the EBS homepage to initiate the process after receiving an active notice of election form requesting coverage that requires medical evidence from the employee. MetLife will email employees a link to an online statement of health within 3 days. Employees must register on MetLife's portal, which is also called My Benefits, before submitting the statement of health. Full details are available on the Electronic Life Insurance Statement of Health Process training resource. For optional life and dependent life spouse coverage, the premium is based on the subscriber or the spouse's age as of the previous December 31st and the coverage amount. Subscribers pay the rates seen here for each $10,000 in coverage. The premium for dependent life child coverage is $1.26 per month and covers all children for whom the subscriber has a policy. MetLife has many useful tools on their website, www.metlife.com/scpeba. More information about MetLife Advantages is also available in a Navigating Your Benefits flyer. For more information about life insurance, view the employer training on retirement, disability, and death at peba.sc.gov/insurance-training. Additional topics covered include continuing and converting benefits at retirement, disability benefits and accelerated benefits option, and MetLife's life insurance claim process. Let's look at long-term disability benefits, which are administered by Standard Insurance Company. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. Long-term disability benefits have a pre-existing condition exclusion. Benefits will be reduced by any deductible income the employee receives, or is eligible to receive, from other sources, including but not limited to workers' compensation, Social Security benefits, sick leave pay, and PEBA retirement benefits income. For complete details, view the Plan Certificate of Coverages at peba.sc.gov/publications. Subscribers are automatically enrolled in basic long-term disability at no employee cost if they enroll in health insurance and are a non-temporary, full-time employee. This plan has a 90-day benefit waiting period and offers a monthly benefit of up to 62.5% of the subscriber's pre-disability earnings, reduced by deductible income, up to a maximum of $800. Supplemental long-term disability is a voluntary benefit for which the subscriber pays. Subscribers have a choice of 2 plans if they wish to add SLTD coverage. Those plans offer a 90-day or 180-day benefit waiting period, which is the time they must be disabled before benefits become payable. If they begin receiving a benefit, it will be up to 65% of their pre-disability earnings after calculating any deductible income they receive. A SLTD monthly benefit will not be less than $100 or greater than $8,000. The maximum benefit period is determined by the subscriber's age when their disability begins. Employees may enroll within 31 days of initial eligibility without medical evidence. Otherwise, medical evidence is required to enroll throughout the year. Medical evidence is also required to change the benefit waiting period from 180 days to 90 days. During open enrollment, employers must review and update the salary information for SLTD subscribers. Premiums and any benefits will be based on the last salary information submitted to PEBA if salary information is not updated. Review and submit salaries as of October 1st in EBS between September 15th and October 31st. Once the information is confirmed in EBS, no further changes are allowed. View the SLTD salary updates training resource at peba.sc.gov/insurance-training. As with life insurance premiums, SLTD premiums take the subscriber's age into account. To calculate the monthly premium, multiply the premium factor for the plan elected that applies to the age on the preceding January 1st by the employee's monthly earnings. There are many useful tools and resources on the Standards website at www.standard.com/mybenefits/SCPEBA. The Standards Workplace Possibilities Program is a proactive disability management program that provides specialists to work directly with employees, employers, and physicians to increase employee productivity, reduce the cost, duration, and impact of disability, FMLA and other absence and disability programs, and support employee participation in health management programs. The Workplace Possibilities Program offers stay-at-work services, which are provided while the employee is still working. The goal is to help the employee perform job-related tasks. The program also offers return-to-work services, which are provided soon after an employee goes out of work. The goal is to return the employee to work quickly. For more information about long-term disability insurance, view the employer training on retirement, disability, and death at peba.sc.gov/insurance-training. Additional topics covered include benefits ending at retirement, disability benefits eligibility, the standard definitions, submitting a claim, lifetime security benefit provision, and member's death while SLTD benefits are payable. Let's look at Money Plus, the state's flexible benefits program, which is administered by ASI Flex. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. Money Plus is an IRS-approved tax-favored accounts program that allows subscribers to save money on eligible medical and dependent care costs. Subscribers fund the accounts with money deducted pre-tax from their paychecks. The Money Plus program includes the pre-tax group insurance premium feature and 3 flexible spending accounts: medical spending accounts or MSAs, limited-use medical spending accounts, and dependent care spending accounts or DCSAs. Useful resources are available at peba.sc.gov/nyb and peba.sc.gov/publications. New employees complete their Money Plus enrollment as part of the hiring process. Employees may also enroll in Money Plus during the annual open enrollment period or within 31 days of a special eligibility situation. Employers must use EBS to finalize the enrollment and provide the number of annual pay periods. PEBA sends daily enrollment and eligibility files to ASI Flex. Employees enrolled in a flexible spending account must re-enroll each year. Employees do not have to be covered under the state health plan to participate in a flexible spending account. They may use the funds in their account to pay eligible expenses for their eligible spouse and dependent children. Generally, if an employee enrolls in a flexible spending account, their elections remain in effect for the entire plan year unless they experience a qualified status change. There are limited circumstances for enrolling and increasing or decreasing contributions for a flexible spending account within 31 days of a qualifying event. Examples of qualifying events include a change in marital status or number of tax dependents. Changes must be submitted within 31 days of the event. The pre-tax group insurance premium feature allows employees to pay premiums for health, dental, vision, the first $50,000 of optional life coverage, and the tobacco use premium on a pre-tax basis. Dependent life insurance premiums cannot be paid pre-tax. There is no fee to participate in the pre-tax feature, and once an employee enrolls, they do not need to re-enroll each year. An employee may enroll when they are hired, during the annual open enrollment period or within 31 days of a special eligibility situation. With a medical spending account, an employee who is not enrolled in the savings plan can set aside up to $3,400 each year to pay eligible medical expenses. The account has a $1.10 monthly administrative fee. Participants can carry over up to $680 to the next plan year. Participants will forfeit funds over $680 left in the account after the reimbursement deadline. All funds are available to participants on January 1st of a new plan year or on the first day of coverage for new hires. Participants have until March 31st to submit valid claims for expenses incurred by December 31st. Eligible MSA expenses include deductibles, co-insurance, and co-payments, medically necessary expenses, prescription medications, and approved over-the-counter medications. A complete list of eligible expenses can be found under Resources at www.asiflex.com/scmoneyplus. Individuals who are enrolled in the savings plan can also enroll in a limited-use medical spending account. The contribution limit is $3,400 annually. All funds are available on January 1st of a new plan year or on the first day of coverage for new hires, and there is a $1.10 monthly administrative fee. Participants can carry over up to $680 to the next plan year and will forfeit funds over $680 left in the account after the reimbursement deadline. Participants must submit valid claims for expenses incurred by December 31st before March 31st of the following year. An employee can use a limited-use MSA to pay for expenses, like dental and vision. Using a limited-use MSA allows employees to save HSA funds for future medical expenses. For a complete list of eligible expenses, view Resources at www.asiflex.com/scmoneyplus. The medical spending account and limited-use MSA carryover work the same way. For example, an employee contributes $2,000 to their MSA in 2026 and incurs $1,200 in eligible expenses during the year, leaving an $800 balance. They will be able to carry $680 over to 2027. They can then re-enroll and contribute the maximum in 2027 and still keep the $680 carryover. Participants will forfeit funds over $680 left in their account after the reimbursement deadline. Medical spending account and limited-use medical spending account participants receive an ASI Flex card that is valid for 5 years. 2 cards are mailed to the participant's home address. Once the card is received, the participant will need to call to register the card and set up a PIN. Participants can request additional cards by logging into their ASI Flex account. The card can be used as either a credit or debit card. If the card is lost or stolen, the participant should report it immediately. Use of the ASI Flex card is optional and might require documentation. The IRS has strict regulations about appropriate use of the ASI Flex card. Each time a participant uses the card, they should ask the provider for an itemized statement of service showing the following: provider name, patient name, date of service, description of service, and dollar amount owed. Participants should be sure to get the itemized receipt before leaving. Providers do not automatically provide them. Participants should keep the paper copy or snap a picture to save on their mobile device. The Dependent Care Spending Account allows employees to pay dependent care expenses with pre-tax income. The contribution limits are based on their tax filing status. For those who are married but file their taxes separately, the maximum annual contribution is $3,750. For single, head of household and married, filing jointly folks, the maximum annual contribution is $7,500. The Dependent Care Spending Account has a $1.10 monthly administrative fee. Participants have until March 15 to spend funds contributed the previous year, but they must submit valid claims by March 31. An eligible expense will not be reimbursed until there is enough money in the account to cover it. Employees cannot take state and federal tax credits if they participate in the Dependent Care Spending Account. Examples of eligible dependent care spending account expenses include daycare fees for children younger than age 13 and adults, summer day camps, and before or after school program fees. A complete list of eligible expenses can be found under Resources on ASI Flex's website. Here are the 2026 contribution limits and monthly administrative fees for MoneyPlus accounts. For more information about MoneyPlus, be sure to view the employer training on MoneyPlus and health savings accounts at peba.sc.gov/insurance-training. Additional topics covered include filing flexible spending account claims, health savings accounts with HSA Central, employer portal with ASI Flex, submitting payrolls and remittances, discrepancy reports, EBS reports, and resources. Let's look at health savings accounts, or HSAs. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. Employees enrolled in the State Health Plan Savings Plan can enroll in a health savings account. Contributions made to an HSA can be used to pay medical expenses incurred during the period in which the HSA is open, and funds can be used to pay expenses for dependents even if the dependents are not covered under the savings plan. Employees have access to their account balance at any time. If an employee uses HSA funds for non-healthcare expenses, the funds are subject to taxes. Employees enroll in an HSA through My Benefits as a new hire or during annual open enrollment. Throughout the year, employees can enroll in or change elections once per month. Employers must approve the enrollment in EBS and provide the number of annual pay periods. PEBA sends daily enrollment and eligibility files to ASI Flex. HSA Central will automatically set up the bank account based on enrollment information from PEBA. The employee will receive a welcome email from HSA Central with instructions on how to fully open the account once it is set up. The 2026 contribution limits for HSAs are $4,400 for individual coverage and $8,750 for family coverage. Employees ages 55 and older can contribute an additional $1,000 per year. If an employee is age 55 or older, has family coverage, and covers a spouse who is also age 55 or older, both spouses can contribute an additional $1,000 per year. There is a $3 per month fee if the participant requests paper statements. HSA Central is the custodial bank for HSAs. HSA Central will automatically set up the bank account based on enrollment information from PEBA. The employee will receive a welcome email from HSA Central with instructions on how to fully open the account once it is set up. The employee must also have zero MSA balance before contributing to HSA. ASI Flex will automatically convert MSA to limited use MSA if carryover funds remain at end of plan year. For more information, view the employer training on MoneyPlus and health savings accounts at peba.sc.gov/insurance-training. Additional topics covered include filing flexible spending account claims, health savings accounts with HSA Central, employer portal with ASI Flex, submitting payrolls and remittances, discrepancy reports, EBS reports, and resources. Let's look at health and wellness resources available to members. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. The following benefits are available to state health plan primary subscribers. PEBA perks, well visits, telehealth, health coaching, Hello Heart, Personify Health, Verta, and Wonder Health. Learn more at peba.sc.gov/health-and-wellness and take a look at our health and well-being member-facing presentation. You can also find ready-to-share toolkits on the PEBA Health Hub. These additional tools are also available online. A change in status can affect an employee's eligibility for insurance coverage. Let's take a look. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. 3 of the most common changes in status are unpaid leave or a reduction in hours, military leave, or a change in position. Employees who averaged 30 hours during a measurement period and are eligible for benefits during a stability period do not automatically lose eligibility for insurance coverage when they experience a reduction of hours or enter into an unpaid leave status. In most cases, health benefits will continue until the end of the employee's stability period or until the employee leaves employment, whichever occurs first. Employers cannot charge more than the employee's share of premiums. Employees do not have the option to cancel coverage unless the employee experiences a special eligibility situation or intends to enroll in insurance coverage through the marketplace. Employees not in a stability period lose eligibility for insurance if they are not on protected leave and experience a reduction of hours below 30 hours per week or enter into an unpaid leave status. The employer should terminate coverage and offer the employee COBRA and/or conversion information, if applicable. Employers may offer coverage again once the employee returns to a full-time position. When an employee goes on military leave, the employee may continue coverage. Employers do not have to notify PEBA. Employers will need to get written permission to continue coverage and bill for premiums. Employees on military leave may also cancel their health insurance due to gain of other coverage by completing an active notice of election and submitting it with a copy of their military orders. To cancel all coverage, complete the active termination form and offer 36 months of COBRA coverage and conversion information if applicable. In all 3 instances, you'll also need to provide the employee with your insurance benefits when your hours are reduced notice. A change of position can cause an employee either to gain or lose insurance coverage until the employee enters into a stability period. Part-time employees who have a change of position from part-time to full-time should be offered benefits the first of the month after their change of position. Here are the rules if the change is from full-time to part-time. Employees who are not in a stability period and have a change in position that results in a reduction of hours below 30 will become ineligible for insurance benefits on the first of the month after the reduction. An employee deemed eligible for insurance during an initial stability period or standard stability period does not lose eligibility due to a change in status. Benefits continue for the remainder of the stability period. Let's look at COBRA coverage. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. COBRA, the Consolidated Omnibus Budget Reconciliation Act. COBRA prevents covered employees and their dependents from losing group health, dental, vision, and/or medical spending account coverage as a result of certain qualifying events. All employers participating in PEBA's insurance benefits are subject to COBRA, regardless of the number of employees. COBRA places several obligations on benefit administrators. You must inform eligible subscribers and their dependents of their COBRA rights and responsibilities. Note that in cases when an employee is found never to have been eligible for coverage while employed, neither the employee nor their dependents are COBRA eligible. You must offer COBRA coverage to all qualified beneficiaries. You must also retain complete copies of all notices and document your actions in the employee's file. All the following documents can be found on our website at peba.sc.gov/forms. Monthly premiums are available at peba.sc.gov/monthly-premiums. Employers send the initial COBRA notice. This notice summarizes the COBRA law and procedures. It outlines the obligations of the employer. It also explains the COBRA rights and responsibilities of employees and their covered dependents. As with the initial notice, employers send the second notice. This notice advises individuals of their rights and responsibilities for continuing coverage under COBRA after a qualifying event. It also explains the procedures for enrolling in continuation coverage. Include the COBRA notice of election and current COBRA premiums with this notice. PEBA sends this third notice by first-class mail to the qualified beneficiaries no earlier than 180 days before the end of the maximum coverage period. This notice tells them when their COBRA coverage will end. For more information about COBRA, view the employer training on COBRA at peba.sc.gov/insurance-training. Additional topics covered include qualified beneficiaries, federal mailing and hand delivery requirements, when to send notices and documentation, qualifying events to extend coverage, and termination. Let's look at EBS, My Benefits, and other tools. This presentation is an overview. It is not meant to be a comprehensive description of the benefits offered by the South Carolina Public Employee Benefit Authority. The plan of benefits documents, certificates of coverages, and benefits contracts contain complete descriptions of the benefits offered by or through PEBA. Their terms and conditions govern these benefits. For more information on each benefit, see the Benefits Administrator Manual, as well as the Member-Facing Insurance Benefits Guide. This slide lists the actions an employer can take in EBS. It also shows what subscribers can do in the My Benefits portal. For additional training, visit peba.sc.gov/insurance-training. This includes insurance enrollments with Employer Benefits Services, or EBS, a request for review tutorial video, and instructions for updating salary information for supplemental long-term disability. You can also join the Employer Advisory Group, hosted by Employer Services, in online sessions. These are announced in PEBA Update. Forms are available at peba.sc.gov/forms, and employer checklists are available at peba.sc.gov/publications. The Navigating Your Benefits series is available at peba.sc.gov/nyb. Additionally, information for new employees is at peba.sc.gov/new-employees. The best ways to get in touch with PEBA or find news for employers include the following. For customer service, select the Contact Us button in EBS, or complete the form at peba.sc.gov/contact-employer. Read PEBA Update, the weekly e-newsletter for employers. Archives are available at peba.sc.gov/peba-update. Email employer services at peba.sc.gov to request training assistance or share your feedback. Finally, be sure to follow PEBA on Facebook and X. Check out our videos on PEBA TV, our YouTube channel, and follow us on Instagram and LinkedIn.